Gastrointestinal issues can be very personal and sometimes embarrassing, and developing an honest relationship with your gastroenterologist is one of the keys to overcoming these feelings. And I'm joined today by Dr. Jennifer Nair. She's a gastroenterologist with Concord Gastroenterology Associates, and she's going to take us through the process of developing a relationship with our GI doctors. This is the HealthWorks Here podcast from Emerson Hospital. I'm Scott Webb. Dr. Nair, thanks so much for your time. Today we're going to go through the steps in developing a relationship with a gastroenterologist, which you are. So how often do patients typically see their GI doctors each year?
So it's variable. So it depends on the condition that they're coming to see me for. So if I have a patient who comes to see me with an acute issue, something like diarrhea or vomiting, and we start a workup, I sometimes will see that patient back in a week or a month to follow up on their symptoms and follow up on the testing results and see if the treatments that I've recommended are helping. There are other patients that I see for more chronic conditions, for example, inflammatory bowel disease like Crohn's disease or ulcerative colitis, or things like acid reflux or Barrett's esophagus. Those patients I see somewhat less frequently if they are in the stage of the disease where things are well controlled. But it's important that we keep up that relationship so that I can continue to monitor their symptoms over time.
Yeah, definitely. And it sounds like it varies depending on the patient and conditions and what you're dealing with. And doctor, I don't want to be treated as a condition or a number, as nobody really would want to be treated that way. I want to be treated as a person. So how can I create a productive relationship with my gastroenterologist to achieve this?
I think a lot of people have that concern. Everyone wants to be treated as a person, and people are individuals and they're unique, and it's important to foster that relationship with your doctor. Personally, on my side, on the physician side of things, I try to learn about my patients not just as their medical conditions, but in the social context of what's going on in their lives. So I like to ask patients about their families, about their jobs, about things that are going on outside of the clinic visit, because it helps me understand their condition and how I can best treat them. And I think that's true on the patient side as well. So I think it's nice when patients come into my office and they ask me about me. I'm not just a doctor. I have a family. I have interests outside of the office. So I think it's good to know who your doctor is. I have a lot of patients who will Google me before coming in so they know what's found on the internet about me before they arrive. And I think that's fine. That information's out there. But I think it's good to talk to your doctor on a personal level and not just a patient-doctor level. Of course, you don't want to get too intimate with your doctor, but I think it's good to have conversations and tell them what's going on in your life.
Yeah, of course, we all want to be conscious of TMI, if you will, too much information, but I think we all have been there. And if I need to reach my gastroenterologist quickly, can I ask for their cell phone number or another way to get in touch with them quickly?
So I think communication with my patients is very important. I think cell phone numbers are not the best way to reach your doctor or reach me or a gastroenterologist, but I think there are a lot of ways that patients can quickly get in touch with their gastroenterologist. So I know, for example, my office staff is fantastic. So when a patient calls, I get a message right away, and if it's something urgent, my office staff will let me know very quickly. So just a phone call can sometimes be a great way to reach your doctor. In other practices, a phone call is not a great way. So a lot of medical centers have set up patient portals where you can send an email or a question through a portal so that they can get that question answered. I think portal messages are also really good because sometimes when I call patients back, they might not be available right at that moment, but an email is an easier thing to check and have access to. So I think portal is a great way. Some gastroenterologists will give their email address, but I think portals are nice because they connect to the medical record, and it's a good way to refresh your memory on patients and connect it to their records in the system.
GI issues can be very personal and sometimes embarrassing. So what if I'm anxious or embarrassed to discuss my symptoms in front of the gastroenterologist?
So this question comes up a lot in GI clinics. So GI issues are very personal and they are sometimes embarrassing. One thing is everything that you're feeling is important. So no symptom is insignificant, and it's important to discuss all the symptoms that you're having with your doctor. That's why you're going to see the doctor. And sometimes it's those little details, even if they're an embarrassing little detail, can help me figure out what's going on with my patients. So one is don't be embarrassed and don't hold back on symptoms because it's somewhat embarrassing to talk about. In terms of anxiety coming in to see a gastroenterologist, I have a lot of patients that come in very anxious to talk about their symptoms. And what I remind them when they come into clinic is I see gastroenterology patients all day long. So I hear about poops and farts and burps and all of that stuff all day long. And I don't think patients should be embarrassed about it because that's my job. That's what I'm here to do, is to help with those symptoms. So I think you don't need to find exactly the right words, or some patients are worried about describing their symptoms in exactly the right way. For me, what's most important is if patients tell me how they're feeling, and then I can use that and figure out what's going on.
So, doctor, what are your top tips for new patients to ease the experience of going to the gastroenterologist?
I think it's helpful when patients think about what questions they have before they come to see me in the office, and I think that also helps with some of the anxiety. So really, I have a lot of patients who come, or some patients that come, and they write down what their symptoms are, they write down what their questions are, and I think that really helps them get the most out of their visit with me. Some patients come and their primary care doctor has sent them, and they don't know specifically what they're supposed to ask, but everyone has questions, and there's never a bad question, and my job as a gastroenterologist is to help answer those questions. And just thinking about it in your mind before coming into the visit, I think really helps the visit go more smoothly, and I do think it helps ease some of the anxiety of coming into the office.
And doctor, I wanted to ask you about COVID-19, and during this time, have you been doing telehealth, televisits, video visits? How has that been going? How has it affected you and your practice? And how's that in terms of building that relationship between you and your patients? How's that going?
So I am doing both in-office visits and virtual telehealth visits. I try to do my virtual telehealth visits on the Doxy.me platform, so it's a video chat, so I can see the patients, they can see me, especially for first-time visits. I think it's really helpful when I can see a patient face-to-face. But I also will do some telephone visits here and there for patients who don't have access to a computer or video capabilities. I think that telehealth visits are great. I think that, one, they're convenient. I think that asking a patient to take off half a day from work to come into the office for a 15, 20-minute visit, sometimes it's a lot. We're asking patients to do a lot, and it leads to patients not wanting to come in to their doctor. So I've found that in terms of developing a relationship with my patients, it's actually really helpful to have the option of doing telehealth because I can see them in a more convenient way more easily than prior to telehealth being so widely spread in the world of COVID. The other thing about telehealth visits is that there are some conditions that I see patients for where the physical exam doesn't always change my thought process for the patient. And there are some conditions where, doing a physical exam, for example, abdominal pain, it is helpful to press on their belly and see what's going on. But for other conditions like acid reflux, there's not much that I'm seeing on a physical exam. It's really more how the patient is describing their symptoms that affects my decision-making for them. So there are certain conditions that are better for telehealth and others that aren't. But in general, I've had a very positive experience with doing telehealth visits with my patients.
Doctor, as we wrap up here, anything else we want to tell people about developing a relationship with their gastroenterologist?
I think you should think of your gastroenterologist similar to your primary care doctor, and that it's okay to call and ask questions. Patients have a limited time in the office or on a video chat talking with their gastroenterologist, and sometimes all your questions don't get answered. And it's okay to call back after a visit and ask another question, or if symptoms are getting worse between visits, it's okay to give your doctor a call and kind of update them on your condition. So I think communication, it goes both ways. I want to make sure that my patients are getting all of their test results, but I also want to make sure that if patients have questions, that they're being answered and that they feel heard, even when we're not in a clinic visit.
Yeah, and we all want that. We all want to be heard, and we love doctors like yourself who are listening, who are honest, who are open, and want us to be ourselves and just tell you everything that's going on. So, Doctor, thanks so much for your time today, and you stay well.
You too. Thank you.
Visit emersongi.org or call Concord Gastroenterology Associates at 978-287-3835 for more information or to make an appointment. And thanks for listening to Emerson's HealthWorks Here podcast. I'm Scott Webb, and make sure to catch the next episode by subscribing to the HealthWorks Here podcast on Apple Podcasts, Google Podcasts, Spotify, or wherever podcasts can be heard.